important. This is the instructions that we've been given about the program. By next weekend, we may not be able to accommodate anybody anymore. So this is an important information. So the topic for today is Lesion Atlas of Poultry Diseases, and we actually had to do this because we realized that there are a lot of vets that during their undergraduate and some of them even after they had completed their training in the tertiary institution, they have little or no knowledge of how the lesions look like. By the time they get to the field, they can't tell the difference between what the normal is and what the lesion is. And that's the reason why we have decided to make like a lesion atlas of poultry diseases. We can't capture everything, but the good part of what we have captured is that these happen in Nigeria. As in all these images were taken in Nigeria, none of them is outside this country. So you can be sure that you are dealing with a local images of diseases that is possible and you may likely encounter during your practice as a vet in Nigeria. These are the contents. There are a lot, like I said today, a lot to be covered, but we have to be very fast in order to spare some time and to be able to cover much. So this is the content, and so, as an introduction, I just said earlier that knowing the importance of having a mental picture of expected abnormalities in poultry organs to judge the probable clinical case in questions. So, we have decided to put together images taken during years of postmortem examination of various poultry birds. They are not limited to layers, we have broilers, we have broiler breeders, we have layer breeders, different birds, categories of poultry birds in across Nigeria, different parts of Nigeria. So that is where we got all these images from. As you can see, the one that is actually the image you are seeing there was actually in Sokoto. So you can tell the extent at which we'll be able to gather information for you. So we believe that this will be able to help the young veterinarian to be able to have a very good image in their brain while they are in the field to do poultry diagnosis. So we will start with respiratory system. So as you can see there, we have, we'll just try to capture different ones. So we have tracheitis. So that is in the inflammation of the trachea, which usually will be followed by cataract exudate. Not all the time, but sometimes. Sometimes it can also be congested. It's not all the time that we have congestion, but this is actually congested and it has cataract exudate as I've shown in the arrow as I'm trying to point. If I don't know if you can see it clearly, but it's actually there. The over there. B, we have congested lungs well, if you look at the anatomical position, you realize that that B is pointing to the lungs, and you can see it's very red. So that is congested lung. And then we have congested lung C. Well, that's the other one. I don't know the one that will be clearer between the two. So that's another congested lungs, as you can see there in C. And then D, we have the enlarged kidney. So this is the kidney, and then it is enlarged. So we are trying to do all this so that you'll be able to differentiate between the normal and the abnormal. Sorry that I didn't put the normal here. In some of the slides, I actually deliberately put the normal there so that you'll be able to see the normal and then be able to differentiate it from the abnormal. But let me just try to quickly. Lungs is actually supposed to be pink in color, but as you can see here, it's really very rare. We are going to still see the normal lung as we continue proceed in this training. So I will show you the normal lung. So you can see this is really very red, blood red. Then the that of kidney is supposed to be flat with the back of the internal wall, supposed to be just a little bit raised above the internal wall at the back of poultry birds, but you can see this one is even raised beyond some other blood vessels and some other organs. So That's why we know that it is an enlarged kidney, and it is having some form of discoloration, as you can also see there. So, what are the diseases that can present this? So, we try to put some diseases that can present this, but this is not exhaustive. So, we still expect that you do more of your work to add more diseases that can present this to what we have already named here. So, we have avian influenza can present these pictures. We have Newcastle disease can present this picture. We have infectious bronchitis. We have mycotoxicosis. We have infectious laryngotracheitis. All these can present some of these pictures that we are seeing here. So let's go to another one. Now, I don't know, have you ever seen something like this before? I know you people have been hearing a particular term. Well, I'll confess to you that I've been hearing it. I'd been hearing it when I was in I think probably in 400 level or so, but I couldn't come to think about how the image will be. How does it look like? So it was after a long time that I eventually got, it was during my field practice, I eventually got to know, oh, this is the look of what we're talking about. And what is that which we are talking about? Hair sarcoitis. So when you hear hair sarcoitis, this is the view. This is what you are going to see. Sometimes it can be this plain, sometimes it may come with some discoloration, sometimes it may have mucus patches on it. So depending on how it looks like, but you're going to see like it is blown with air, and it's an indication that the ear sac is inflamed. So if you look at A, if you look at B, if you look at C, that is ear circulation. I decided to bring this different view of it so that you'll be able to see. Actually, this is in different animal. If you look at the top also, you will see another raised raised area. You will see another raised area. I don't know if you can see where I'm pointing my cursor, but if you cannot see, there is another raised area around here. It's also ear sarcoitis. So this is how ear sarcoitis look like. So by the time you are doing postmortem and you see something like this, you know you are dealing with ear sarcoitis. And the probable infection, we have colibacillosis that is caused by E. coli. We have a CRD, that is chronic respiratory disease, that is caused by Mycoplasma gallisepticum. So, and many other, definitely, but this is what we talk about when we talk about ear sarcoitis. This is how it actually looks. So, let's go to digestive system. That is for respiratory system. For digestive system, what do you see? So you can see there a chymotic hemorrhage of proventriculus. So the very tip of proventriculus, you see bleeding at the tip. Then we have petechial hemorrhage of the proventriculus, as you can see in B. This is actually what you can also see in mycotoxicosis. You can see it in Newcastle disease. You can see it in Clostridium perfringens infection. So this is for digestive system. We have a lot for digestive system. So that is why we have to move faster. So you have ruptured liver with clotted blood. As you can see in here, we have swollen heart. You can see the shape of the heart. You can see the apex is somewhat, the apical part is somewhat bigger than it's supposed to be, and it's somewhat rounded. It's not pointed, it's rounded, so which is not supposed to be. So there is the swollen heart. We have or enlarged heart. We have engorged liver too. As you can see in C, you can see very red. Liver is not supposed to be this red. So this is supposed to be, it's not supposed to be this deep red. And you can see internal bleeding in D. So all of this also, they are they are part of what you can see in mycotoxicosis. You can see it in fatty liver hemorrhagic syndrome. So you can see some other diseases that we have not mentioned here. Then we have another set of liver, enlarged yellowish liver. We have necrotic foci on the liver. We have engorged liver too, as you can see, also see there. So all of these are also a pointer to the different infection. You can see it in salmonellosis. You can see it also in mycotoxicosis, which I didn't write here. You can see it in some other infections in poultry animal. So we also have ruptured liver. This is really badly ruptured. That is another image that we you can see there. So ruptured liver, and you can see that it is really badly ruptured because all the clotted blood are now they are formed like a fibrin on that liver. Then at the other side, you can see excessive abdominal fat, which you can also see in fatty liver hemorrhagic syndrome. So um, let's continue. Okay, so this is bronze color liver, and then we have friable livers too. Yeah, when you hear friable livers, this is actually the look of a friable liver. Immediately you touch it, you can see it peeling off, as evident on in the pictures that you can see there. So we can see that in microtoxicosis, you can see it in salmonellosis. Just trying to be fast so that we can conclude it in time. So we also have a possibility of having what is called pericarditis and perihepatitis, then swollen liver. As you can see, A is showing swollen liver. If you look at the edge, you will see the edge is not smooth. If you look at the edge of some of the other liver that we have seen before, you see that the edge is somewhat smooth. So when you see the edge is not smooth, that's an indication that the liver is swollen. And if you look at the pericardium and the hepatic liver, the liver, you will see that there is perihepatitis, and you can see the covering of the liver, the covering the liver. Then we have also the pericarditis, as you can see in C, and then some liver in A. So you can see that in salmonellosis, you can also see it in fowl cholera, you can see it in some other disease that also have not been mentioned here. So let's go to, we are still in digestive system. Look at the intestine. You can see internal bleeding. You can see hemorrhage of the small intestinal wall of various fashion and various shades. So I decided to just bring these three up so that you'll be able to have at least a mental picture of different forms. Some of them can be pinpoint, some of them can be, you can see like a brush, as you can see in the third slide. So we actually see that you can see it in avian influenza, you can see it in Newcastle disease, you can see it in mycotoxosis, you can see it in helminthosis, you can see it especially when it is roundworm, and then you can see it in salmonellosis too. So these are places where, I mean, diseases where you can see this view that we have just seen now. We are still in digestive system. So it's in small intestine. I'm just trying to bring more view. You can see that in the first slide we had, it was just plain, but this one is showing you some of the content you may see, and you can see even worm, live worm, as you can see around here. I don't know if you can see my cursor, but you can see live worm here, which is still alive, just coming out. And if you look at the wall, the intestinal wall, you will see so you can see that you can see hemorrhage in some at the background of the mucosa. So you can hemorrhage of the intestinal mucosa, enteritis with mucous exudate mixed with some food material, which is also what you can see it in coccidiosis, you can see it in helminthosis. So, and you can see in some other diseases that we have not also mentioned here, which we are going to mention in detail one after the other later. So, this is what I'm talking about. If you look at this now, I decided to put normal liver, I mean normal spleen. I don't know if you can see my cursor, but this is the normal spleen. Can see it, and the one in the middle, that's the normal spleen. But if you look at the one on the top and the one beside it, you can see they are engorged with blood, and their color is quite different because they are engorged with blood. You can see the gallbladder too, B. You can see it very engorged, and it is even popping out from its position because it is highly engorged. You can see it in mycotoxicosis. You can see it all this in fowl cholera. So let's continue. We are still in the abdominal cavity, the digestive tract, Well, we are moving a little bit from digestive system now. We are moving to the abdominal cavity. So we have hemorrhage of the abdominal wall, and then as you can see in picture A, you can see the hemorrhage is very evident in picture A. And if you look at picture B, you can see hemorrhage at the abdominal fat of the poultry bird. And this is what you can see, because some people may open up and just there is fat and that is all. But more than seeing the fat, look at what is happening to the fat at the body of the animal, because actually this fat is not excessive when we're talking about broiler. I mean the broiler breeder, it's not too much, because broiler breeder are actually they have high abdominal fat. But when you now start seeing pinpoint, this not this is much but not really excessive. It's not of serious concern. So when you start seeing pinpoint hemorrhage, as you can see all around, that is an indication that there is a problem happening somewhere, because uh, the fat, abdominal fat is supposed to be just white, not like gray. I don't know. You should know better with color. So that's how it's supposed to look without this hemorrhage that we are seeing there. So you can see that in fowl cholera. You can see it in avian influenza. You can also see it in Newcastle disease. Let's go to reproductive system. So in reproductive system, we have misshapen follicle, congested follicle, ruptured follicle, as you can see in various pictures, and the arrow are pointed. And so this is just like I said, is to give us a mental picture. When you are reading your manual and then they mention some of these things, should be able to marry the picture of what you are supposed to see in all the diseases and marry it with what is written in the book or in the note that you are reading. So you can see some of these in infectious bronchitis. You can see it in avian influenza. You can see it in Newcastle disease. You can see it in fowl cholera. You can see it in mycotoxicosis. So you can see congested follicle. The follicle is supposed to be like this second picture, especially the first one in the second picture. But if you look at the third picture, you can see it is really, really red. It's not like the second one. So the second one is the one that is apparent, no, fairly fine, or let me say fairly okay. But this third image where B is really, really red. So that's congested follicle. And you can see the ruptured follicle in C, that is likely going to cause peritonitis eventually in the animal, and may eventually lead to septicemia that can eventually kill the bird. So that's why they are of importance. So we have also athletic ovary. This is okay if the animal has not reached a reproductive age. But when an animal has reached lest I forget, I was talking about uh, the way lung is supposed to look like. So you can see the pinkish color of lung in this picture. So this is how lung is supposed to look like. Should be pinkish, unlike the dark one that we saw earlier. So if you look at this now, you can see all the ovary have been kind of resolved. They have become athletic. They have. It's like they are inactive anymore. It's as if this animal has not reached a reproductive age. Let me show you the previous slide. You can see in the previous slide that in all these animals, there is still a follicle. Once an animal reaches a reproductive age, there will be one type of follicle or the other. They may have problem, but at least there will be a follicle. But if you look at this picture, there is no follicle. It looks as if these animals have never reached a reproductive age, whereas they have reached a reproductive age, but unfortunately, their ovary have become athletic. And even if for you to know that they have reached a reproductive age, if you look at B, you will realize that even their uterus is becoming atrophied, is shrinking. It was initially big and active, but if you look at the B, but if you look at it now, you see that it is shrinking, which means that it was once active, But after a while, it became inactive and is now degenerating and resolving, becoming is shrinking. So that is uterine atrophy. You can also see that in infectious bronchitis, Newcastle disease, mycotoxicrosis. Sometimes it can be genetic factor. Well, for the genetic factor, you instead of the ovary developing with the uterus during reproductive age, they just don't develop. So that is the genetic factor that I was referring to. For nervous system, you may want to check this first and record your observation because you may not easily detect them once you open it up. I'm just going to show you some things for you to know what I'm trying to say, that you have to check it first before you open it up because you may even miss it altogether. And it's an important thing that you are supposed to recall. In the next slide, you are going to see there. So look at the way these animals' heads are. You can see the one that turns it up. You can see the one turning sideways. These are some point that they were experiencing a form of nervous signs before they eventually died. Some of them is maybe their leg. You can see their leg is tilted apart, as if they wanted to run as at the time they died. Different things will be indicated. So it's better you look at it right from start. I mean, right before the postmortem, look at the image. Is it showing you opistotonus? Is it showing you torticollis? Just try to look at something that you can infer from the shape of the animal's head as at the time the animal died. I put this top picture there because, well, that's learning on the field. I got to understand that you can detect heat stress if you open up the skull of the animal. There is going to be hemorrhagic, as you can see here. So that is another thing you can use to know that probably the animal was undergoing heat stress before the bird died. And that was why I decided to put this one there in this place. So excretory system, well, we've talked partly with about that. We have enlarged kidney, and as you can see, all the kidney I put there, they are enlarged with different degree, and not all of them have a problem with their lungs, but you can see the kidney is congested in, especially in B, and swollen, and in here you can see it's enlarged, rising, is raised above the level that it's supposed to be. So you can actually see this in infectious bronchitis. You can see it in gout. You can see it in some other diseases also that we did not mention here. So let's continue because the time is no longer there. We have circulatory system. We have the heart, petechial hemorrhage on the heart, especially when you see it at the body of the heart. You see it at the neck, the neck region of the heart. You may want to be very careful because it's tending towards a sign of an infection. And then you can see hydropericardium. Hydropericardium is another thing. Dr. Victor, you are welcome. Please try to mute your microphone. So you can also see hydropericardium in B is filled with fluid. So you can see that in fowl cholera, you can see it in Newcastle, you can see it in mycotoxicosis. So for the circulatory system, let's go ahead. Continue with what we are doing. So we have integument, skin. You can see this is reddish. This animal died, but if you look at their breast muscles, the subcutaneous tissue, it looks as if there is serious congestion of the subcutaneous tissue, and that is kind of similar to all of them. And if you look at it, you can also see prominent blood vessel. So you see it in avian influenza, you see it in fatty liver hemorrhagic syndrome, you can see in some other diseases, but especially avian influenza. Sometimes you can see something similar in Newcastle, but is not so common, like in avian influenza and fatty liver hemorrhagic syndrome. So this is another thing that you are supposed to take note of. It's important. Then, if you look at this, we talk about the skin. I mean the eyes. You can see the swollen eyes, but some can be so badly swollen that the eyes will be totally closed, and that will even make feeding very difficult. So this is another thing we're supposed to be very careful. I mean, we have to take note of and take care of. Infectious coryza can present it, vitaminosis A can present it, infectious bronchitis also can present with something like this. So we are supposed to distinguish what actually this the causative agent is. Now, some of you might have heard about gout. So this is how gout looks like. Um, can see it's the urate. You can see it in the heart. It's just under the pericardium. Look at the kidney. The kidney is filled with urate. Look at the internal organs. You can see the urate all around. Even look at the ear sac. Urate everywhere. It depends on actually the degree. There are some of them you will just see it faintly in the heart, faintly in the ear sac, faintly in some internal organ, and faintly also in the kidney. But there are some it will be very evident. Sure, this one is very evident, and that is why I took this picture. And you must not confuse this with pericarditis. It's quite different from pericarditis. That's one of the reasons why I had to bring this up, because this is not pericarditis. This is actually urate. And the way to know is that you can see that white patches. It look as if like white painting is found in different parts of internal organs, different parts of internal organs. And when you want to even conclude that, okay, it's not pericarditis, go straight to the kidney. We see that the kidney is also enlarged and filled with, is kind of filled with white patches, like the deposit of the urine. So let's go to this. The one that I show you is actually in female, but this one is in male. So the question is, how did I get to know that this is a male? Uh, can any one of you respond? How do I know that this is male? Dr. Victor, is Dr. Victor there? Okay, Dr. Janet.
Yes, yes, sir.
Oh, okay.
Yes,
So
sir.
how do I know that this is male?
Yes. The testis.
Oh, very good. Very
And see
good.
the testis.
All right,
Yes,
very good. So
yes.
I just wanted to be sure. Well, thank you very much. Because you see, the first time I actually saw the testicle, I was telling a colleague that what anatomical structure is this? It's just unfortunate because I've never opened a male bird before this time. I mean, before the first time I saw it. Well, because I worked in a breeder, I worked for a breeder farm, so I saw a lot of male. I had to post a lot of male animal. So to the extent that there were some that without testicle, there were some that they have atrophied testicle. But what I want to bring out is that when you have not seen something before, it's very hard for you to know what anatomical structure. Sure, it's not impossible. You may be thinking it's like an inflammation of a particular organ or an anomaly, that's congenital abnormality. So this is actually testicles, and you can see the heart, that it is also the white patches on the heart. So I decided to lift up in the last picked image. I decided to lift up the testicle away so that you can see the kidney very well. Even at C, you will see it. So I deliberately put D. That D is representing testicle, but I didn't put it there because I wanted to ask the question to be sure that you guys can recognize testicle and you're not like me that I was seeing it for the first time and didn't know it was a testicle. So that is for that. And then we have um, some questionable events that we saw on postmortem table. Take for example, look at this. I'm not too sure what to call it. Does hernia occur in chicken? I don't know. But if you look at this, immediately under the skin, you can see a perforation that is suggestive that there is no muscle. There was no muscle immediately after the skin. So, because if you want to talk about, if you want to call it trauma, that will not be perfectly right because the skin was intact. There was consistency in the skin. There was no bridge in the skin consistency. I was the one that eventually opened it up like this that you can see. So immediately under this thing that I opened up, because I just saw that that part was red, so I decided, okay, let me open it up before I even started my postmortem to be sure what made this part to be red. And I realized that there was no muscle under, there was no form of muscle under that skin. So I said probably it's an hernia in chicken, who knows? So I decided to bring it here because if you see it, you may also have opportunity to see such a thing while doing your postmortem. So this is the low. So this is another unknown case. Uh, so I saw this A. The animal is so emaciated, as you can see, the bone very prominent. But unfortunately, there is a side of it, the right side, that look very swollen with reddish points. So I decided to open it up, and we realized that we are not too sure of what is actually contained. So I don't know, but you may eventually read it up, and probably if you get an answer, you can educate us so that all of us can learn. Because I'm not too sure what the cause of this is. But like I said, you can read it up, and if you get any answer to that, you can let us know. So that's not the only one. This is another one that almost all the parts of the animal is filled with caseous exudate. Almost every part. As you can see, different labels that I put there, internal organs, membrane, everywhere was filled. Ear sacs, everywhere was filled with caseous exudate. So, but if you look at other things, look at spleen for example. Spleen is in the third picture. Spleen is okay. Nothing is happening to the skin, to the spleen. I didn't. I'm not sure you can see the liver, but liver is not here. But liver also was fine. Then if you look at the heart also look okay, but the lungs and every other thing, we are thinking probably it is avian tuberculosis. We are not sure. So, but we just put it there as unknown case because I'm not too sure, but you can read it up and then you can provide an answer to that too. This is another one. So this one is not caseous exudate like the first one. This one is calcification. All of these things that you are seeing, they are like hard bones. All of them that you are seeing here, and it is in different abdominal organs. Even on liver, you can see it in the second picture. You can and the fourth picture can see that they are also on the liver, and they are hard. They are calcified. So even on ovary, on some you can see it also in the abdominal hair sac, and they are all calcified. So what could have been the cause of this? Is it a tumor? Is it, I don't know. So this is another thing that was bringing my own curiosity, and if you find an answer to that also, I would like us to discuss it. So that is another unknown cases. So from observation inference, as we round it up, recall all your observation, eliminate the unlikely diagnosis. By the time you are doing your postmortem, you should be very close to definitive diagnosis from your experience. very, very close to definite diagnosis, that you can say, go to the lab. This is what you will likely find as a cause of this disease. And then always remember that non-infectious diseases can also cause mortality. And always remember that feed diseases are usually from mixed infection. So this is the disease of the week, infectious bowel disease, and we are expected to do some assignments like read more on infectious bowel disease. It's just a way of training one another so that we can all be able to have better knowledge. So thank you very much. I don't know if there are question and answer. I think I'll take one or two before we close for today. Thank you. So Dr. Janet, do you have any
Yes, sir.
question?
No question, sir.
Okay, Dr. Victor. Dr. Victor, are you still there?
Right. Yes, sir. Yes,
Okay.
I am, sir.
So any question?
I don't have any question. No, sir.
Okay. All right. So okay. So I decided to send this slide earlier so that we can also kind of study it, and so probably when you are studying it again, like I said, these are pictures from years of postmortem examination, and we've tried to bring them together to be able to let me say, give benefits to those people that might not have been doing much of poultry, or they even do poultry but they don't even know what they see. So we have decided to bring that together so that while reading the book, you can have a mental picture of what you are reading in your book, and that may be able to help. So in the absence of questions, I think we've already passed the time allotted for this training. And I want to say thank you to everybody that has participated in one way or the other. And I want to say that we can still invite people that may be interested to join this Young Veterinary Diagnostician training program. By next week, we are going to be talking about projects and how to go about it so that people can be able to do what will benefit them. So I want to say thank you to every one of you that has come on board, and let me say bye from here. Thank you very much. Bye for now.
Sir.
Thank you, sir.